Welcome back to the Grim and Glamorous podcast, and we are your hosts, LBG and Drea. So, Andrea is talking to us remotely.
Hi guys, how are you? Miss you.
So, you're in Southern California with our family, like a normal person, and I'm stuck here in Louisiana for
What do you
school.
mean like a normal person?
Well, I don't know, like, I feel like people are, like, trying to, like, get back to their families and be self quarantined and, like,
Well, I
uh,
think you're better off because you're not with anybody.
yeah, I mean, I
If
guess
you think
that's
about it.
that's one of the things about what's going on is just like the numbers and the testing and all that stuff. But um, yeah, so we wanted to devote this episode today to talk about the coronavirus, COVID-19, what's going on, just because I feel like it's important to address it, to acknowledge it. Um, I feel like a few other social media podcast people have been kind of struggling to like, how do you address it? Do you ignore it? Is it safe to talk about other stuff?
Mhm.
Like I know Jenna and Julian had an episode and they're trying to be like lighthearted, but they also had a video that was pretty like serious and just reflecting on it. So I thought since we've kind of been off and on in terms of our episodes here, it'd be good to kind of like this is just a good first episode to get back into
Oh yeah, for
like
sure.
normalcy. But I guess my first question, just because there's a lot that's happened and there's stuff that changes every day, and
Mhm.
like what's in the news today is very different than what it looked like a week ago.
Mhm.
Um, like when did all of this become like real for you? Like when did it really hit that like, oh wow, this is a serious thing that's going on that's changing our lives? Like when did that happen for
I
you?
want to say like I can't really give you all the details because it has to do with the work, but like when everybody was like going home, they were sending people home, and like we basically got like orders to stay home. Our I work at like a mall, and our store was closing, and it was just like, all right, well, you guys are closed until we tell you to come back, and it was kind of like scary, and then all of a sudden we got like a like because I think it was essentially like a few stores that were closing, and then now it's the entire mall.
Yeah.
So like um,
So this
the
was
mall is yeah.
sorry. So this was at a moment when I feel like your business and a lot of other businesses were having these conversations about um, like what steps to take exactly, how
Mhm.
and how long you're going to be out is still kind of up in the air for a lot of people.
Yeah.
But for you, it was sort of like, okay, they're sending people home for a significant amount of time. Like this is
Mhm.
serious.
Yeah. It was crazy because like when you first get there, like to the mall, like I work at like a very busy mall, and like even before then, even like before we knew that we were closing, like uh, everybody knew that like the coronavirus was like spreading like crazy, and especially like where I live in Orange County, it's like spreading, and it made me laugh that like nobody would stay home. Like the people were like buying stuff like clothes and like shoes and stuff like that. Um, it like boggled me. I'm like, why are these people staying home? Why don't they want to be with their families? Why don't they want to be at home just like to be healthy or whatever? But um, but it was like it cracked me up a little bit. I was like, these people are not going to stay home. Like the reason that they're staying home is because the mall would have to close. Like
Mm-hmm.
there would have to be nothing for them to just stay home. I don't know. It just kind of weirded me out. I'm like, I don't understand why people like are like this. Like why they want to continue to you know continue to shop or continue to like be outside when something like this is going on. When it's like that this, I guess, what do you call it? A disease, a virus, this
Mm-hmm.
illness is like super, you know, you can catch it pretty easily.
Yeah.
Um,
I
so that's why, it kind of was just like you could you could be in the same store with somebody and get it 2 weeks later. So like that's why I'm looking around and it's just like people are buying like Victoria's Secret or their Nike or whatever, and I'm just cracking up because I'm like, okay, these people clearly do not care.
Well, because at this point, when this was happening for you and they were sending people home,
Mm-hmm.
there were still some stores open, and so there, like malls were still open, and I think today they're being shut down. And now we have like a national standard that's been put forth by the White House, but at this point, people were still shopping at, like you're saying, like Nike and whatever.
Mm-hmm.
But I think that's one of the big issues that's been in the news this week is that I'd say like a good number of people are taking the necessary precautions and steps, and I think maybe some people were skeptical at first before they really believed it was getting serious, but I think we're well past that point.
Yeah.
But I think in the news, there just the past few days, there's been stories about people that are like on spring break and like young people, college students that are still partying and going out
Oh
and
yeah. Like
don't really care.
they don't, and it's like I saw one on the news, and there's this kid, and I guess it was Florida. I don't know, like somewhere where it's big to like party for spring break, and he was like, "If I get coronavirus and die, I don't care." That's what he said on the news,
Yeah.
and I was just like, "Really? Like, are you just saying that, or are you, is that you're just saying it for TV?" Like, but it's pretty bad. Like, I mean, especially if you don't know if you have something, or like, I guess if you have asthma as a kid, or, um, you know, you have breathing problems or something like that. Like, it can get really bad. So, that's why I'm just like, people need to like really take care of themselves.
Yeah. I think it's really hard for Americans in particular, just like given our way of life is we're used to just going about our business, and yeah, I don't think we're used to having things on a mass scale just not be available.
Oh yeah.
I don't remember when I've ever seen anything like this, and maybe like post 9/11. I remember 9/11 when I was in like 7th or 8th grade, and some places weren't open for a few days, and like the airlines weren't no there were no planes.
Uh-huh.
That was probably the closest thing I can remember where there's been something like that, like disruptions to everyday life. But
Uh-huh.
this is a whole different thing and a whole different um, animal, so to speak, because you're not fighting something political or it's like a virus. It's microscopic. So it's a whole different thing.
Oh yeah. Like,
Yeah.
and I think that's the thing that kind of makes it more scary is that like now that everything is closed and like you go to the grocery store, I don't know if you've experienced this or not, but like when I went, this is also another like time where it was like real to me. Like I went from work and there's a Trader Joe's, like you know, like a mile or so like down the road, and like I was like, oh, I need to get something at Trader Joe's. So I think I went to go and like eat with my friend or something like that. We went to go eat, and then I was like, oh, I gotta stop at Trader Joe's to get something. And I went to Trader Joe's, and I was like, okay, like I walk in and there's like a ton of people, but like that's normal for Trader Joe's to have like a million people. So like I walk in and I get like what I was gonna get, and I think it was like for lunch the next day. And then I was like, well, because I never just buy one thing at Trader Joe's. I have to buy like the whole store. So like I was looking around and I was like, what? And like usually like they usually have like a full like chip aisle, like tortilla chips, like potato chips, and like salsa and stuff like that. Like there was nothing. There were no chips, and I was like, okay, this is weird. Like all the like fruits and vegetables are there. It's fine, whatever. There was like maybe like half the meat were gone. Half the meat was like gone. You go down like the frozen food aisle, like there were sections of frozen food that were gone, and I was like, okay, this is weird. Like, what's happening? And like people were just like panic buying like all kinds of stuff. There's like a whole like thing of like frozen food that were like empty, and like the Trader Joe's people are like casually just putting things away. Like I don't even think that they knew like what was happening. They're just like, okay, people are just buying stuff. I was like, oh, okay, like what's happening? But I better buy something because I don't know if if I'm gonna buy it again. I was like, okay, like I think I know what's happening. People are stockpiling now. I better
Mm-hmm.
buy something. I better buy, what I can get from this store because what if this is the last time I go to the store? I bought pancake mix and cookies and some tortilla chips. That like one of the last bags of tortilla chips that they had. And then, I was like, well, I better stock up on breakfast. So besides the pancake mix, I bought a box of wheat waffles, like the toaster waffles.
Heavy on the breakfast food then for your
Well, because I was
panic
like,
buying.
well, I'm gonna need breakfast for
Is that
tomorrow, and then
yeah?
plus, like the following week, I'm like, if we are gonna be at home, we're gonna need breakfast every day. So I bought pancake mix, which I'm kind of regretting now because the pancake mix requires an egg, and we don't have any more eggs. So I was like, well, it was a good idea if we had eggs.
Yeah, I feel like panic buying and all that stuff, stockpiling, like that's been another huge issue. And I'll admit to buying some stuff also. Like I remember and this also goes to like what made it real for me, like that this was actually going to be a pretty serious thing for a while. Some of the other schools in the area were closing down, and this was in the wake of like other campuses being closed, and some of them were closed pretty early on, um, like Harvard,
Uh-huh.
Columbia. I think it was like Ohio State. They kind of took measures early on to end classes on campus, move online, all that stuff, and so here at LSU, we were just kind of we were anticipating like they're probably going to do something. And so they just basically gave us 2 weeks off and told us not to come back to campus. We're going to move stuff online. So that night, I went to Walmart at around
Uh-huh.
11. They closed at 12, so they started to limit the hours. And
Uh-huh.
I felt kind of silly just like going around buying stuff because I like really didn't know what to get. But other people were like stockpiling food and clothes,
Uh-huh.
toilet paper, paper towels. All the cleaning stuff was basically gone. Like whole aisles of cleaner were gone.
Uh-huh.
Um, so I just bought like some water, some snacks, like soup, mac and cheese, crackers, stuff like that.
Uh-huh.
And then I ordered a bunch of stuff on Amazon, which so that was one thing I noticed that like Amazon usually you'll get stuff in 2 to 3 days with Amazon Prime, and this took about a week to get here. But I got like a lot of water, um, like soda, first aid kits, just stuff that I bought at the time where I'm like, yeah, I don't know if this stuff is going to be available or
Uh-huh.
it's sort of like hand sanitizer. I have not been able to find it anywhere.
Oh, nobody
So,
has. Like,
yes,
there's no hand sanitizer.
yeah. So, I bought stuff cuz like the day that it started to feel like okay, this is a real thing. This is
Uh-huh.
um when that hit me, I went out to go shopping, and I mean, it's worked out so far. I mean, I think it's still stuff that's useful and valuable that I've started to use. And
Uh-huh. Are you running out of food? Do you still have food?
no, so I still have food, and some of the restaurants here are takeout only. So I don't know if it's like that in California, but a lot of restaurants here are takeout only. Some of them are closed completely, but that's I think the tricky thing about a situation like this is that if you shut down everything, it's going to tank the economy, and it could be worse than it really is. But you also have to control the spread, flatten the curve, they say, social distancing, all
Yeah.
that. So it's really interesting to see different places put in different measures because, depending on how long this goes on, this could really destroy, family businesses. People could go bankrupt. The economy's already people are talking about an economic depression. So there's a lot going on. And that's the other thing, too, is like how long will this go on for? I don't think people really know.
Right.
But I think a lot of places, like workplaces, also are sort of like telling people, okay, for the next 4 weeks, we're going to be closed, or for the next 3 weeks.
Hmm.
I think it's sort of like a day by day thing for a lot of different people. The other thing I was gonna mention too, where it kind of got real for me, was when one of the NBA players tested for corona,
Hmm.
um, and then they found out it was two players, and then they just suspended the whole NBA season. And I think for
Yeah.
a lot of people, they were like, "Whoa, like that was serious." And then they canceled March Madness, which
Oh,
was,
yeah, that's right.
yeah. So I think that was a big shocker to me, and that was really like, okay, this is really happening, because March Madness is a huge, not just for sports, but like a huge like economic business thing for the country. They have like 40 games in like one day over 2 days, and they're in like cities all over the country, and it's supposed to help local cities. It's sports, it gets the whole country involved. But the fact that they just like canceled it outright, that was like for me a big moment where I'm like, wow, I don't remember anything like
I
that
was gonna
happening.
say, like, you're pretty big on the March Madness, so
Yeah. And then I guess like most sports are suspended. Almost all sports are just sort of in limbo right now. But I think for good reason. I think a lot of people are taking these measures in stride. But I remember when the news on those first broke, a lot of people were like upset, or like it's not that serious, blah 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 blah. I was looking at, and this goes to like how quickly this can spread, like you were talking about. So the NBA team, it was like the Utah Jazz. Yeah, two players from that team had it, right? And
okay.
then they were saying, okay, over the past 5 days, those players have come into contact with five different teams in five different cities all over the country. And so that was really like a panic moment, because they were like, they didn't really know how viral this thing was. And
Hmm.
so they were like, okay, potentially that's five cities. And so I think that's why they just immediately not canceled, but suspended the season, because they travel, they're in huge arenas with 20, 30,000 people. They shake hands, sign autographs and stuff. I think they recognize that sports is uniquely a place where it can spread, because these teams travel a lot. And I think that was one of the big things about how this is spreading globally, is that it's through travel, it's through our global economy and system, and just the way the world
Hmm.
is, our businesses rely on trade and travel and your ability to go from one place to another. And so I think this was done in an effort to like limit the exposure in the US, which hopefully these measures are going to pay off. But
Oh, yeah,
it's sort
no,
of
for
like,
sure.
yeah, it's sort of like in the meantime, people are bored at home, and usually they would go to sports to kind of like distract themselves. And the fact that we don't have it is frustrating, but I think also it speaks to how serious the situation is.
Hmm.
we talk a little bit about what it was like for you to go shopping. You're going to a store, you're seeing stuff gone. Um, what has it been like in general, like in California? Because I know that different states have different situations going on. Has it affected traffic? Has it affected, do you have restaurants that have to go, like orders only or drive through? Are some things still open? Like, what is it looking like in SoCal right now?
Well, right now, I think it's pretty much every like food establishment like closed their cafe part, and if they have takeout, then you're only supposed to do takeout or like Postmates or something like that. If there's a drive-through, like I want to say it's like half and half. I'm not really sure, but like if there's a drive-through, then some places are doing drive-through only. Some places are just like closing the cafe and doing walk-up orders and
Yeah,
leaving.
I heard
I don't know about
Starbucks.
McDonald's. Like I know Starbucks for sure. Like is they close their cafes,
Mm-hmm.
and if they have a drive-through, then you can either walk up and do a mobile order, um, or go through the drive-through. But if you're cafe only, like they're not like letting you stay inside. Um, One of my friends like uh, did like a IG story, and like they had to tell people like you can't stay here anymore. Like we're closing the cafe, so like all the chairs are up. Like you can't sit inside anymore. Um, but there are, yeah, it's mostly just drive-through, takeout, or um, like Postmates or whatever. So, but
Have you done like takeout from places?
we did go to like Dunkin' Donuts the other day, and that was just like drive-through only. And I think In and Out. Oh, In and Out closed like if you're connected to a cafe in the In and Out, like they close the cafe and it's like drive-through only now. Let's see. I think Chick-fil-A also was like drive-through only.
Yeah. Well, if In and Out's still open, I think we'll all be fine.
Sure. I mean, In and Out, the burger stand that's holding the world together.
Yeah. It's kind of funny. Like, I was thinking about how this has really, like, disrupted a lot of people's lives, but, I don't know, like, for myself, like, I usually get to go orders anyway.
Okay.
And when I'm in, like, the school mode in the middle of a semester, I'm usually, like, pretty busy and, I don't have a lot of time to go out and, like, go to the mall and go to the park or, whatever. So in some ways it really hasn't changed a lot for me,
Mhm.
but in other ways, having to like work from home, like that's one thing. Like I work for the college and in like the writing center, and I'm used to taking like appointments with people in person, sitting down with them, working on projects on campus. And so to me, school and work was kind of like this seamless thing where it's all there on campus. And so now, we're on break, so maybe it hasn't really it's hit me and like affected me, of course, but um, like just getting into that mode of transitioning to everything online
Mhm.
is an adjustment. But in terms of like going out and like ordering food, like I think the fact that places are still open and doing takeout is sort of a big comfort and is helpful for people, because I think it does, you look for any semblance of normalcy
Mhm.
and you want to try to keep things as normal as possible, even though you obviously can't do that. But
Mhm.
like for me, I'm like trying to make it feel as if, okay, like it's not as big of a disruption as it could be. You can still, if you're trying to look for like a silver lining, you know, you can still have an In-N-Out burger. You just can't sit in the place, or
Mhm.
you can still have a Starbucks coffee, but you can't enjoy it inside the restaurant. You have to take it home or whatever. So,
Yeah.
um, you try to look for things that are like sort of positive in the midst of all that. But and obviously the situations are changing, day to day. So we may come to a point where, Starbucks is closed and McDonald's is closed completely.
Mhm.
Um, but yeah, it's interesting to see that. I feel like California has been one of the states that have been heavily um, taking measures to try to address what's going on, to try to limit the impact on the healthcare system, to try to prevent the spread, and like, I mean, do you feel like they're doing like a good job of like having that leadership and like telling people what to do and keep them updated on the day to day stuff?
Um, yeah, like I think so. They issued like an order, and then like they're taking it seriously to a point where like everybody has to stay home now. But that's because of the governor. How about I just listen to what the governor says as opposed to Orange County
Yeah.
because he's doing a way better job. So,
Yeah, I think
um,
that's part of the confusion is that um, you have like you have local mayors of like the city that you live in, but then you also have at the state level the governors doing things. At the federal level, you have Congress and the Senate trying to come together to create something, and then the executive branch, you have the president and his team trying to come up with a plan that works. And so yeah, I think you're hearing a lot of different things from different sources, and so that can be a bit of a confusing, mixed message situation.
no, go
Um,
ahead.
I was just gonna say, what do you think about this plan that they're trying to work on to give everybody like $1,000 or multiple payments of $1,000? Like, do you think that's gonna be helpful for people that maybe their job closed indefinitely, and so like, do you think that's a good thing that's
Oh
gonna
yeah,
help?
like I think that's pretty good. Like, I mean, it's good for them because like they still have some money to hold on to until they can find another job, or like if they need to pay bills, or like um, if they do get paid like while they're off work, like you can use that to either like have money to order food, or order something to keep you busy. Like I think like you can use that money like in multiple ways. So um, like I think it's a pretty good idea. You know.
Yeah, it's yeah, I think so too, and I'm glad that it's gotten bipartisan support. Nobody really knows how long this is gonna go on for, so
Mhm.
is it maybe they give us a few payments like for a few months, and then if it drags on longer, they may have to do it again. But yeah, I think it's going to be helpful, at least in the short term, to help people that are looking for jobs, because like I know people that have been laid off. We have family members that have been
Mhm.
lost their jobs because places are closing. Some people have been fortunate where they can work remotely and they're still going to get paid. But I think it's going to be helpful. Any So I guess just like any final thoughts about the coronavirus, the situation going on right now. Anything that really sticks out for you?
I think that um, well, there's a couple things. Like, I mean, yeah, it is scary, and yeah, like there's a lot of people right now that have it. Like, yes, like I mean, like you possibly could be exposed to it wherever you go, but it's just better to like stay indoors, wash your hands, take a shower regularly, wash your clothes really well. Um, but also, like, don't freak out. Like, don't panic. You're at home now. So, like, just hang out, think positive, find a hobby, find something to do. If you're working, obviously, keep working. If for some reason, like, you can't be at home and you have to work, like, if you work at Starbucks, if you work, at like these grocery store places, like, you know, hang in there. thanks for thanks for doing what you're doing. But yeah.
Yeah, I think I would echo that. Just to take it seriously. I know there's been a lot of talk about young people maybe like not caring as much or that they if they get sick or not, but I think it's really that misperception about that it's not just the effect that it has on yourself individually, but you could be an exposing or a carrier for somebody that's in a group that might be susceptible or a high risk group. If they're like immune compromised, if they have lung or breathing issues, cancer, autoimmune diseases, stuff like that, that leaves them more susceptible to, serious impacts from the disease. I think that was one of the big things that, I retweeted a few stories about celebrities getting coronavirus because,
Yeah.
like Tom Hanks and his wife were sick, um, Idris Elba. And the reason I retweeted that and I thought those stories were important was because obviously they're recognizable public figures, but in both of their cases, they really didn't have severe symptoms. I know Tom Hanks's one of his sons was saying that they didn't even really feel sick. They were in Australia. They kind of just had like minor cold symptoms and but they got tested anyway, and they were
Uh-huh.
surprised by that. Idris Elba said that he really didn't feel sick at all, but he
Uh-huh.
was exposed to somebody that was confirmed to have had it, and so he got
Uh-huh.
tested and was surprised by the results. But basically, the message there was even if you don't have severe symptoms, which it can cause, you can still catch it, you could still give it to other people, and so um, yeah, I guess the message there would be just to like take it seriously, to try to comply as much as possible to, your local, city, state recommendations, and not everybody's in a position where they can work from home.
Uh-huh.
So it's not like some people have that ability and are fortunate for that, but other places they rely on their income. They have to work. They have to expose themselves. I know a lot of healthcare workers, like nurses, doctors, um, they're on the front lines of this. Grocery clerks. I hear that a lot of stores are just like spending overnight to like restock and um, they're sold out during the day and then they restock at night in a lot of places. And so and then I would echo what you said earlier about just not panicking. um, they were saying that there's really like the whole thing about toilet paper, which sounds kind of silly, but people are just like panic buying it, and you may go to a store and panic and say, "Oh, they're sold out. That means I should just buy a ton of it whenever I see
Uh-huh.
it."
Yeah.
But really, there's like no shortage of it. I guess they're just like not even close to being like a shortage on it. Like they just may be out of inventory at a store, but they're gonna get it in the next day
Uh-huh.
or refill in a few days. And so I think just like not panicking, not rushing out to like like withdraw all your cash and like stock up for 30 years. You
Yeah,
know,
there's not really a point to that. Like,
yeah.
I don't know.
I mean, it's just I think this is another thing too that I think I kind of learned from at least just the early days of this going on is that we should always be in a position to anticipate or be prepared for emergencies. It's interesting to see the reaction here in Louisiana. I think is very different than California because a lot of my friends, uh, coworkers, classmates are from Louisiana or like New Orleans, and somebody was saying that like they're used to like hurricane season and they remember Katrina and they remember floods from a year ago, and so they're kind of used to like okay, like there's an emergency situation, you need to like have food and water and like basic stuff like that. It's just like they're familiar with it, so they know that that's something that should be on your minds.
Mhm.
And I heard also this is like Jenna Marbles when she and Julian were talking about their situation that she like grew up or like went to college somewhere in like a blizzard heavy state. I think like upstate New York. Did she go to Syracuse or I don't know where she went, but
I want to say Boston, but I'm not sure. It
Boston,
might have been
yeah.
Syracuse.
No, I think you're right. I think it was Boston, and like there were times where there's snowstorms, and you just like have to be indoors for a week. And I think being familiar with that environment kind of takes away some of the panic a little bit because you're like, okay, it's just another thing that we have to endure for a little bit and whatever. But I think if you're not used to it, it can be very easy to fall into that panic mode,
Mhm.
which is not a good thing. But I think this is it's sort of like what's that the Boy Scout motto, like always be prepared or whatever.
Yeah.
I was not a scout, so
Neither was I.
but like if in California, how long have they been talking about like earthquake season and not earthquake
That's
season, but like
true.
the big one, and everybody's sort of like been expecting it, and it hasn't hit yet, and it's sort of like I think this is just really like
Knock on wood, it hasn't hit yet.
yeah, I think it's just like a wake up call though for people to like maybe you should have a first aid kit and a flashlight and batteries and some water just in case something happens. I think it's just there's a difference between being smart and being paranoid, and um, I think there you need to have that balance of not panicking but also not being underprepared. You know,
Right.
and
No, for sure. Um,
yeah, I think that's just
there was
smart.
one. Yeah, I mean, like here, let me tell you. There was one time where somebody like returned something, and in the bag there were tissues. There were used tissues in the bag, and I was like, "What do I do?" like, I'm not gonna take the item out of the bag. Like, so I made the person who returned it. I needed to take the item out of the bag for me, and you need to show me the item because I'm not going to reach my hand in there. Like, this was like, I want to say a couple months ago when everything was like starting to
Mm-hmm.
happen. Like,
Yeah.
when everything was like, kind of like, oh, be careful. Like, maybe wash your hands a little bit more. Maybe like use some hand sanitizer. Like, this is before everybody like was in panic mode.
Mm-hmm.
But I was just like, ooh, I'm not touching that.
Yeah.
So like you can just tell, like you can tell, like people are gross. People don't have common sense. People are nasty. So
Yeah.
you know what I mean? I'm just like, that's my thing. I'm like, don't be gross.
Yeah, I think they've been really emphasizing like taking those measures to wash your hands, to like not cough and not sneeze, and it just sounds like basic common sense, but I think you're absolutely right that people need to be reminded about it sometimes,
Mm.
and given what's going on, it's just sort of like these are steps you have to take, and for as much as people talk about like social distancing and I've seen a lot of memes about it or whatever, but I think it actually is an
Mhm.
important thing because you know if you're within a confined area and somebody's sick and they sneeze, like that's a huge risk factor, and so
Yeah.
I think it's just being extra cautious right now is just really important.
Mhm.
I think I would add maybe one more thing, just sort of to kind of wrap things up. Um, is just we're all inconvenienced, we're all under some sort of stress of varying levels. It's a scary time for a lot of people, but to show kindness, to show compassion for other people, even though it's going to be difficult. I think I've noticed like a lot of friends, family have been reaching out maybe more than usual. Um, Even people on social media that I'm kind of like tangentially friends with, and we all have we all have those friends on like Facebook or Instagram that we kind of know them maybe, but they follow us a little bit, but we really don't stay in touch with them a lot. And I think the fact that we have social
Mhm.
media and we have things like Skype and FaceTime and podcasts and videos and all of that stuff is like we've never been more ready to communicate, at a distance. And so it's kind of ironic for me because I feel like even though we have to be distant from people, I feel like it's brought people closer together. You have friends staying in touch and checking up on you, and
Mhm.
I would say like show that kindness also to other people. Check on your neighbors, check on your friends. Maybe you can't go in person, but send them a message, give them a phone call. Um, if you're out shopping and you see an old person struggling to like get food, maybe help them out as much as you can if they're, are willing to accept your help. And, I've seen a lot of stories about, how Italy's handling it, and they've been showing a lot of like solidarity and singing in the streets and playing music and just finding a way to stay connected and, as like a boost to morale for people that, might be confined a little bit right now. Um, so yeah, I would say just like be kind to people,
Yeah.
be more patient. It's tough. We don't know how long it's going to go on for. That's sort of one of the frustrating parts for me. It's sort of, you like to have a time frame, but I think it's just sort of impossible at this point to predict what things are going to look like tomorrow, let alone a week, a month, 3 months from now. And so,
Mhm.
but I think people are doing what they can. You can have your opinion about whether we have the right leadership at the local, state, federal, different levels. People can disagree about how they're handling things, but it sounds like they're making and taking steps to do what's best for people, and so hopefully these steps are going to be helpful towards accomplishing that. And depending on how long this goes on for, you know, um, it could be a lot worse. And so I think that's what, I'm glad that we're at this point where, at a national level, at the state level, local levels, they've they're taking it with the utmost um, seriousness. And so,
Yeah.
and it is something that like, what it looks like today, Thursday, Friday, like last week, a week from today, a week ago, it was sort of a very like day by day things are changing, and I think it's still like that, but it's grown in seriousness and it's grown in like like you're saying, cities have been locked down, things are closed.
Mhm.
But yeah, I would say be kind, but also yeah, stay positive. We'll get through this. It's I think by taking these steps, hopefully we can get back to normal as soon as possible. But it makes me also think like how much we take for granted on a day-to-day basis. Your ability to go to the mall or a theme park or the movies and go to a restaurant and sit down, and they sound like simple things that I think people don't think about. But when something like this happens, it's sort of like, oh wow, like when was the last time I did something like that? When was the last time I really sat down and enjoyed a meal with my family at a restaurant? It makes you think about what normal looks like. Also for normal for a lot of people, for people that I think one thing that this has done is highlighted people that are experiencing poverty or sickness that don't have, like, their normal was already compromised.
Mhm.
And this is making things even worse. But it's also bringing it to light for people that didn't have a lot of struggles every day. And so I've seen a lot of those conversations on social media that like, okay, It's been a struggle to live day to day for the average person, and now everybody's affected by something. And so hopefully those conversations will help enlighten people about, what it's like to live on a daily basis.
Mhm. Yeah, no, for sure.
Yeah, I mean, my ideal scenario is that this will implement changes, you know, for society, for politics, for people to help make their lives better and easier. It shouldn't take a national catastrophe and pandemic for the government and people to like care about each other.
Yeah.
It should be a given, but I think this is sort of waking people up to challenges that people experience. But
Mhm.
yeah, that was all I had. I mean, I think we talked about some really important stuff, and I think it was good to kind of just um, talk about what's out there because it does change day to day, and there's a lot of misperceptions. And but I think to talk about it, to acknowledge it, that it's affecting everyone's lives, was important for us to do. And hopefully our listeners will get something out of it because now's the time, I guess, to listen to podcasts and watch videos and stuff.
Yeah, no, for sure.
So I think that wraps up our episode. Thanks again for calling in and making this happen.
Oh yeah.
But yeah, hopefully we'll be able to post a little bit more. I think we made the tech work for today, and hopefully we can upload some more stuff. Maybe some more lighthearted content. We know some people are like kind of look forward to sort of distractions in times like this, but
Yeah, no, for sure. We'll totally do that.
yeah. Thank you so much for listening to our podcast today. I think we have like I try to follow like where people are listening to our podcast, and because we started, was it like Halloween a year ago? Is that right?
Yeah, we did. Yeah.
And you can kind of see like where listeners coming from, and a lot of them are from the U.S., but some of them are from like international, which I was kind of surprised. So if you're listening abroad, thank you. We hope what we say and provide for you is interesting. But yeah, in general, for everybody, just stay safe and healthy, and yeah, we'll see you next time.
All right. Take care, guys.
All
Stay
right,
safe.
bye.